Kenya's population, according to every 10 years, we have a population census, right?
We do.
Go enumerate, count people. In 2019, we did that.
We did.
And we were told we how many million?
55.
No, at that point we were 49, right?
Oh, then when the last one was done.
Yes.
And
then we were also
gone
told
into the future
that our population is growing at a rate of about 1 million newborn children in this country every year. 1 million children every year or thereabouts. Okay? Now that means it's been 5 years. How many then are we now?
So 54 million.
Bas, there. Okay? Many of these people, so already we have 5 million children under 5. That means
5
if you go,
and below.
imagine, if you just go back 10 years, we have 10 million children who are 10 and below. Hey, my friend. So our population is just young. What's our future looking like in terms of all these young people? They need what? They need school. They need what? They need job opportunities. They need what? They will need houses. They will need what? They'll need all those things. What are we doing with this young population? They'll need jobs, of course, so they can pay rent and pay all the other services. And that's why there needs to be a policy on what you do with your population every so often. There's a new one, Sessional Paper number 1 of 2023. And that's why, for now, we're going to have the next conversation about this demographic that we have. What is Kenya planning to do with its demographic? Can it actually take advantage of the young population that it has and draw a dividend out of it? That's what they call the demographic dividend. Dr. Mohamed Sheikh is the Director General of the National Council for Population and Development. Did you know that such a thing exists? Many don't. She's here to tell us why they're here. Bernard Onyango is a Senior Research and Policy Analyst at AFIDEP. He'll also tell us what that is. Good morning, Dr. Mohamed and Bernard. Good morning.
Good morning.
Good morning.
Welcome to Kenya's biggest conversation.
Thank you.
Siti, give our guest the day's proverb. And this week the proverbs are from
the Republic of Zambia.
All right.
Jump over a log, but not over a neighbor's word.
Jump over a log, but not over a neighbor's word. Dr. Sheikh, how do you interpret this proverb?
Oh, wow. It's a tough one. But I like the beef, the canned beef
by
and the canned chicken. I was also looking for the canned camel.
Next. Talk to them.
Good thing. Yes.
So now this one is jump from a log, isn't it? Or the log.
Don't jump over
a log.
Jump over a log.
A log, yes.
But by all means, but not over a neighbor's word.
I think this one probably is something related with advice that you can do once you are advised or you are given, certain advice by your neighbor or your friend. I think it's always good to be cautious. You can do other things, you can jump from or whatever, I think, but that advice is, I think, the focus of your proverb. Yeah.
It is.
Don't ignore it. Bernard, what's your interpretation?
I align. Yeah, I just think, yes, you can, be cautious, especially, your neighbor really probably knows some interesting things you don't want to take for granted. Therefore, you need to take your neighbor seriously. Yeah.
Never ignore your neighbor's advice. Okay, that's a good one. So, Dr. Sheikh, what is the National Council for Population and Development?
So thank you very much and good morning. The National Council for Population and Development is a state agency or a parastatal under the National Treasury and Economic Planning. This institution that was created or that was established in 1982. We just celebrated last year 40th anniversary. In 1982, what was happening in Kenya had one of the most rapid population growth in Africa. And there was a concern at that time that the world will be experiencing what we call population explosion and other matters. So this institution was created to advise the government on population growth. Our aim is to link our population growth with our economic growth, that our population, if it's growing rapidly, also we must grow our economic rapidly. So the objective of this institution is, one, is to analyze, research, and advise the government on population matter, advocate for population issues, especially for family planning and reproductive health, identify key population issues that which the government is not giving priority, and do research and advisory papers on those population issues and advise the government again. Again, also the role of this institution is to coordinate programs of population and management across the country, whether it be the county or partners. So it's also to coordinate. And I think lastly is public education. And public education, I mean, this institution is supposed to, one, to educate the policymakers, give them evidence for purpose of planning, and also talk to the citizen or the wananchi on issues that affect them. So, for instance, right now, as a country, the issues that we identified is issues to do with teenage pregnancy as a council. Initially, we used to focus on family planning, but right now our focus sometimes, it changes on the key challenges that's affecting our population. For instance, teenage pregnancy is that every year in this country, more than 300,000 girls below the age of 18 years get pregnant. And mostly it's a mismatch or mistimed or unwanted pregnancy. So 300,000 is a loss. You just say that every year we add 1 million people or children. But even if 300 of them are dropping out of school because of pregnancy, it is something that will be catastrophic to our economic growth. So what we are saying is that our girls must finish their education, must harness their full potential, and the only way to do is to not them to get pregnant and have a preventive measures, especially keeping them in the school at that early age. So this institution is mostly an institution that links our population growth with our economic growth and looks at factors that affect the population, and then how can we match our population growth with our economic growth. So generally this is an institution that was established that time, and our focus and our mandate still remains the same.
Is there a deeper definition of population rather than just the numbers, the number of people in a country population? Is that deeper?
So, very nice question. So sometimes people just look at the number. The number is very important, but what is very important is what is within that number. What we discuss, what we hear, we talk about is about population size. That's the most important thing. But then you have to look at the population age, the population structure, the movement of that population. Because once you understand that, what we call those population dynamics, then you can plan for that population. Because the need of a child who is age 5 years and the need of an elderly man who is about 65 years is totally different. So a young man who is 30 years, a child who is 5 years, their need and their requirement is totally different. So for you to plan for them, you must understand their age, their size, where they are, their density. So those factors are very important. I'll again look at their dependence ratio, their density. All those three factors are very important. So the number is important, but what's important is also what is within
that number.
Numbers.
Is that what they call demographics?
Demographic, I think Dr. Bennett will explain better, but the demographic is a study of the population or the numbers. So the key things that, those numbers that within the population. So demographic is a study, but I think what you wanted to mention is the demographic dividend, probably. But I think Dr. will explain very well. He's a demographer. I'm a medical doctor, although I have done a lot of demography, but he can put more that one in a very better perspective than me.
Yeah.
So I think, like he says, it's, the demography, when you're thinking about it, is a study of the population. And so you're looking at the different, what are the different aspects? And actually there are a couple of aspects, as he said. One is the population age structure. So, age and structure. There's, but, for you to have a population first, right, there are three things. Someone has to get born, so there's fertility, okay? At some point, you die, okay? So mortality. And then there is the mobility or migration. So those are the three main aspects that that form, or at least they form the basis for population studies. So, but of demography, the study of demography has been extended because and that's why you hear about population studies, to also look at these other socio-economic aspects that interact with population.
So we then now have a policy on population, and it's not the first time. We have policies, we keep reviewing them. Is there a policy on how often a policy should be reviewed?
I think generally they are guidelines on policies. So policies are long term, so either 5 years to 10 years. Because within the policy, after policy, you develop either strategies, and the strategies are shorter than policy because they input into the policy. So for Kenya, our population policy, we just took an interval of 10 years. Because after every 10 years, we do census.
Yeah.
So once we do the census, then we get new data. And then with that new data, then we can plan for our population. That's why we do our policies after every 10 years, because it follows the census. So the last census was done 2019. This population policy that we have launched just recently just started immediately. But the process is very long. It requires a lot of public participation, approval by the parliament, the cabinet, a leaders conference. So the process takes a long period. And that's why 10 years is what we have given ourselves because of our government and our planning mechanisms. And
There's certain elements that you mentioned when you talk about a growing population, and with a growing population, there's obviously a greater demand on certain things that are necessary to fend for them. Is it a challenge for Kenya's population as it is? Since the last census, odd 5 million people have been added to that number. Till the next one, another 5 million will be added. Is that a challenge, or are things progressing as they should?
So from our perspective, or from where we sit, Kenya, compared to other African countries, what we look at is the intercensural growth of the population, the growth between one census to the next. When we were in 1982, our intercensural growth was around 3.3%. Right now, our intercensural growth is 2.2. So in terms of population growth as a country, we are on target. At least our population growth is not as rapid as it was those days. So it has come down. But then what you need to do is, are we matching that population growth with the resources? Because if you look at our Vision 2013, we gave ourselves an intercensural growth of a target of 2.2 with an economic growth of 10%. We have never reached 10% economic growth. Because what happens is that once you have a population growth of 3%, you multiply by 3. So your economic growth must be 3 times more than your population growth. So we have never reached that level, or that what you call target of our economic growth. Our economic growth rate, I think the latest was 5.7%.
So we average about 5.
Around 5 there.
Okay.
So at least then what it means,
We are doing double.
at least there's somewhere there, but it means there is a population that is always in there, that is falling, off the crack, that they're not getting, to the level, the quality that we wanted, that they are poorer, that they are not getting the necessary resources, they're not getting the necessary services. So what we need to do is, how can we triple or even do more in our economic growth? So that's what we have to be doing for us to match this population growth. But comparing ourselves with African countries, we're almost there, we are doing well. But we're not really, compared to other parts of the world, we are not.
So how badly must the other African countries be doing? If we're doing this badly and we're considered to be doing well?
Just compare yourself. If you travel across this country, we just know Kenya, our roads look like, how our airports look like, and go and visit other African countries. Then you will really appreciate where we are.
Actually, I think that is where the problem is, because we look at big infrastructural development and we assume that is the sum total of how well we're doing.
Right,
and yet the sum total of how well we're doing should be the lowest common denominator.
Right, I agree with you.
The individual who needs most help and how that help is made available.
I agree with you.
Yes.
I agree with you. But, we look at very many parameters in terms of demography. We look at our population growth. We look at our fertility. We look at our maternal mortality, child mortality, our stunting level for our purpose of human capital. All those figures, when you look at, they are coming down. They are reducing some of those factors. But then is the target we have set, we have not achieved. Like maternal mortality, we're supposed to be by now by less than 100,000 per 100,000 maternal, live births. But we are not there. Child mortality is still high, but when you look at in terms of progress, we have made good progress, but not as we expected. If you look at stunting, we are around 19% of our children aged below 5 years stunted. Stunting is, a child who is not achieving, the right milestones. That's a child who will not achieve his potential when he grows because he's not neurologically or what you call mentally. At least he's a bit handicapped. So look at those things. Then we can say, compared to other countries, we have progressed very well, but then we are not there because we are not comparing ourselves. You have to compare yourself with others who are doing very well. Yeah?
You compare yourself with the best. Bernard.
Yeah.
So what are these factors that then affect these things that Dr. Sheikh is talking about? When you talk about infant mortality, when you talk about the stunted growth and the development of this population, why is it that we are not getting to where we wanted to get to? What is hampering us?
Okay. First, let me just start by giving a picture. I think she asked about how many people are we at. When we talk about he's made a good point that population growth rate has come down to about 2.2, 2.3, the last census, in the census period. When your population is growing by 2%, okay, it means you are going to double that population within 30 years. So wrap your head around that. You're going to double your population within 30 years. So today,
2054, we will be 90 million.
Actually, the UN projections show that we'll be around, by 2050, we should be hitting about 85 million people. And our neighbors in Uganda, for example, will be, as I was telling you, if you compare the fertility rates, our neighbors will be over 100 million. East Africa region will be talking about will be well over 300 million people. Wow. Kenya, Uganda, Tanzania. That's Kenya, Uganda, Tanzania. So, I think that the thing about it is, and why the census is very important, and the population policy, really the aspect about planning, development planning, we can't do without really thinking about this. People we think short term, but then in 20 years, right now we are grappling with the issue around capacities in school. Can we take in all the kids? Do you have the infrastructure to do that? We can't do that without thinking about these numbers. Okay. We can't plan. I think we have the new policy, the health, the SHIP, is it? We can't plan for that effectively if we are not thinking about these numbers going forward. Yeah. So you say, why are we not getting?
Why is everything not growing in tandem? Our population rising, then everything else also improving at the same rate.
Yes.
Or better.
So one, to say, first we have to recognize things are they're moving in the right direction, but not fast enough. Okay. So whether it's on issues of mortality, child mortality, maternal mortality, if you look at the last 10, 15 years, the progress has been steadily positive, but not fast enough. I think part of this challenge, if you look at on population growth itself, there are many factors. People talk about, when some of us talk about population, people immediately think about, family planning, and, family planning is an issue that at times has become contentious. But if you look at, for example, the use of modern methods of family planning, that has also been improving. But you have what we call unmet need. That just to show you one of the problems. You have like about 18% unmet need. What does that mean? 18% of women in reproductive ages who would like to either, they want to wait, maybe because they are still too young to start having kids, or there's someone who has started childbirth but wants to postpone, say, the next birth.
Yeah.
Or someone who has said, okay, I've had the number of children I want to stop. Okay. So 18% of people who were surveyed, who were asked this question, said, yes, I would like to do these things. I'd like to use family planning, but I'm not using. You see? So the question becomes, why are they not using? Why are they not using? Some of them are not using because they don't have the knowledge. They don't have the knowledge of where to get, for example, the effective methods of family planning. Some of them are not using because those family planning, the contraceptives, are not available. Some are not using because the range, the contraceptives, you have a wide range, and some people do well with some types and not other types, but maybe we have a limited array of that. And there are these differences, the usual differences. We know that access in rural areas has always been a challenge compared to urban areas. But you come to urban areas, you have the urban poor. So there are those kind of challenges. What are the challenges? Some of them, it just comes down to the issue of education. You look at fertility levels over time, and all that trend is always that the more educated are choosing to have smaller families. Maybe because they have the means to make that happen, or maybe because they have the knowledge for that. But it's there. So there are those differences. You start looking at. We say we are making progress as a country. You start looking at, you go down into our counties, and you realize that Kenya it's very diverse. The outcomes are very diverse. There are places where fertility levels are almost similar to the global average, and then there we have counties traditionally from the marginalized areas where the fertility levels are where Kenya was in 1978 when we were noted as the
most fertile country on earth.
Exactly. So there are a myriad of issues.
When we talk about population growth and we talk about the need to be able to provide for this population, are we saying we don't know how this should be done?
We know. We know. And that's why population policy is very important. Because one thing we need to understand is that our population is our resource number one.
It is.
So for us to utilize that resource appropriately, we must understand our population. And what we need to understand is what are the key factors or demographic factors of our population. Number one, what is the size? That one I've talked about it. What is the education level? What is the skill? What is the age? Currently, as we speak, as a nation, if we look at our population when we got independence in 1963, our population was around 8.9 or 8.6 there. Today we're talking about 54. We have multiplied by 5. But when you look at our population at that time, and even up to the 80s and the 90s and even up to 2000 something, our population was more of a child-based population. There were more children than compared to the working age cohorts. So then there was a high dependence ratio that the children, because they depend on their parents or they depend on the few working population, there was high dependency ratio, and it's because that was coming from the child-based population. As we speak today, when we got independence, our population with that 8.9, our elderly population was around 200,000. Today, as we speak, our elderly who are above 65 years are more than 5 million, at least around 6 million. Just almost as the population we had when we were getting independence. That's the number of elderly persons that we have in this country today. So what we need to do is to understand this population in terms of their need, because the need of an elderly person who is 70 years is totally different from the need of a child, and it's totally different from a person who is 30 years. And then in between there is this what we call now the youth bulge that's happening in this country. 75% of our population are below the age of 35 years. 75%. A huge chunk of them are youth, around 13 million are below the, I think between 15 to around 34, a huge population. So we are in a situation where many times we compare ourselves with countries like the Asia, and we look at what we call the miracle. What have they done in a short period? The Asian countries, they did what we called accelerated economic development in a short period. What did they do? They did heavy lifting. Because that time when you have that youth, it's just like me and you. We start from a childhood. There's that movement until you become 60, 70, and then even population itself, it moves like that. Yeah. There's a cohort. One time Kenya will reach where the numbers of elderly person, maybe more than even, will be.
This 75% will be old.
will be old. We'll reach that level. But when we reach that level or that day, like right now Japan, the average age of Japan today is 49. Well, the average age of Kenya today is around 19, 20 years. So one time we will reach there. But by the time we reach there, are we rich enough to sustain our population? Because we are not producing as young when we were young. So what we need to do right now is like a helicopter, or a plane. When the plane is taking off, it uses a lot of compassion. It uses a lot of energy when it's taking off. So this country is at that stage where it's taking off. And this is what we need to do right now, is to do what we call heavy lifting.
What does that entail?
Heavy lifting means investing in our youth in terms of their education, their health, governance, and their skills, and creating jobs for them that matches their skill. We need to be a nation that is producing more than it is consuming. And we need to save as a nation. This is the right time to do it. And this is what we call the demographic window. It may happen. Kenya is just entering that demographic window, and that demographic window is an opportunity that will last for, let's say, 50 years. By the time we are there, by 2100, Kenya population will be totally changing. It will be more. It will be like what's happening right now in Europe and Asia. It will be that kind of status. There are countries in Latin America who do not utilize the demographic window. Those countries today, they have an aged population, but again, they are also poor.
Yeah.
They are aged, but
they're poor.
So as a country, we are that. When we are taking off, what we need to do is do a bit of what can I call a bit of heavy lifting. Make sure that our youths are engaged in a very productive manner, and they maximize their potential. This is the time to build roads. This is the time to save. And this is the time to do all those things, so that at least we can say we are like South Korea, we are like Malaysia, Singapore, which we talk about all the time.
Dr. Sheikh, it sounds like it's an obvious thing. Like, you're looking at it, and everybody has been talking about this population bulge. Africa has a population bulge. And so this is a time to take advantage of this window, because the window will one day close. Is it that obvious, Bernard? Is it that obvious to everybody? Like, is then the policy giving us the obvious things? Is it telling us, okay, so this is what you need to do? Is it so obvious?
So the policy is, gives you, it's like the policy is a guideline. Okay. But I think the question you ask, is it obvious? And that city asked, I think there's the sort of the challenge we usually have. I know Dr. Sheikh said when he asked the question, we know what to do. But I think actually it's a bit more nuanced than that. There are people who know what needs to be done, okay, and then there are also the people who need to do it. So the question, I just shared some numbers with you today about where this population will be in another 30, 40 years, and I'm sure that's something you probably you're not demographers or people in this space, so you're like, oh wow, you're going to double this population. As we are talking now, we think we are a big number of people, and it's still going to. So think about it. In Kenya today, we are implementation is happening at county level.
Yep.
Okay. And our people at Treasury, at planning, are using this data at National Treasury Planning, of course, when they're doing all this. The question is, do all the people who are making those decisions at the different levels also understand the same issues? I think that's where at times we have a disconnect. And actually, and I didn't actually introduce what I do, the AFIDEP, the African Institute for Development Policy. Our mandate really is to, we met this case that there's a lot of research out there, but it's not necessarily being effectively used. So one of the things we try to do as AFIDEP actually is we say we want to make evidence matter for decision making. And therefore, we have this agenda around evidence-informed decision-making, where you need to work with the different stakeholders. They need to understand the data. What are the implications of this data? When we say that we are going to have, for example, free secondary education, how many schools do we need in that county to actually absorb those numbers? And for example, I'll give you another. I told you about these differences in fertility levels in counties. So there are counties where probably they should be thinking about, when you're building schools, maybe there are some counties which should not be thinking about building too many primary schools because they may not. And we've seen this happening in other parts of the world, where as that age structure changes, so you have fewer people. So you won't have the same demand at primary school level as you had 30 years ago. So don't waste too much resources on that. Look at where the people will be. Maybe they'll be at secondary, or maybe now you need, to have people at tertiary level. I'll give another example about. He's talked about what we've seen in the Koreas of this world. But if you look at sub-Saharan Africa today, Southern Africa is one of those countries where we say they're farther along the demographic transition. Their age structure is now at a level where they should be really leveraging this demographic dividend. Right. They have a lot more young people than they actually have children. But the big challenge, and you can see how this is affecting, for example, the ANC, is because you have all these young people, but they don't have jobs.
They're jobless.
So the unemployment rate in that age group, the 20s, early 30s in South Africa, is closer to 50%.
So they're disillusioned.
They're disillusioned, but also it means that your dependency, while you thought that the dependency burden should be going down because you're having fewer children under 15, actually the dependency is still actually probably increasing, because up to age 30, people are saying living with their parents, they don't have jobs, you have to take care of them.
Some of them will have their own families and they're still living with their parents.
So those I think it's about making some of these data evidence more visible and working with the stakeholders to actually, these decisions, we make our decisions based on evidence.
And I think that's the question, Dr. Do we actually make decisions based on evidence and data that has been provided? Because that fantastic example that you gave about constructing of schools in the next 5 to 10, 15, 20 years, are you building more primary schools, or are you focusing on building more secondary schools within your counties? And this is something that you should do based on the data that has already. We have an entire department for this information, but are we actually using that then to decide what will be done in the future? And I dare say that we're not. And it's not just in that sector. There are very many sectors where the data that is being collected painstakingly every day is actually not being used for the development in different sectors and different areas. And for me, that's where we need to get to first, whereby decisions that are being taken, money that is being spent, is done based on the data that's being collected. If not,
I want to dovetail on what Ndu is saying by asking the question, and that is to both of you. If indeed data such as what we have here in summary is actually used in the manner that it should, what should we see?
So, I think what I'll start with her question or her assertion that it is not used, and I'd say that no, it is used, but maybe not to the not as effectively as it can be done much better. Okay, it can be done much better, and there are places where there are data gaps. Okay, there are places where there are data gaps where we need. For example, we are talking about education and skills. We say there's a skills mismatch, but more often than not, what the data we have around education have not focused before on actually. It's now people are now doing it a bit more, but the quality of education. We used to look at participation, enrollment. Very easy to actually measure, but now it's a quality, the outcome. So those are the areas we need to go to. Then the second bit is again, I'll give an example of the counties. When we talk about data, we have, for example, census data, which is done once every 10 years. We have other surveys, which may be important surveys. They're done after 5 years. But what about the date? Actually, the most important data is the day-to-day administrative data. But the people who are at this level, have we built their capacity to understand how important that data is that is being collected at county, sub-county level, for example?
Have we?
No, so those are the gaps. So those are the that's what I'm saying. So we have gaps. So we need to strengthen that. Have an evidence agenda that where we really strengthen one, not just the capacity, but for people to understand that it's important. It is important. Why is it important?
It's something that happened in this country a while back. I'm building on what I asked. And there was this thirst and quest to make every institution that we had a university. Was that evidence based? Did someone understand
it was demand driven?
It was demand driven. That is a good thing, but what sort of demand? Because we now have this push now for TVETs. We had TVETs. Many of them were turned into universities. What was the evidence that we're using then? And because we collect data, we have information. The information to drive those decisions was there. But was that what drove those decisions to where we sort of like moved forward, backpedaled, and then now we're starting to move forward again? That's really what I'm asking when I ask what should it look like.
So I think the question you ask whether we are using evidence to implement our programs. I can tell confidently that we are using evidence to implement our programs. I'll just give you one program. The vaccination program in this country, which is a very successful program. As you said, more than 1.4, 1.3 children are born every year in this country. With that number, if you ask today in this country, as much as sometimes we have challenges, every year we procure more than 1.6 BCG, just one. I'm just giving you around more than 13 vaccine types. But we procure 1.6 million and even more vaccines for those children, projected for the number of years to come. So in terms of planning, I know we may not be there, but at least we use our population data to plan because what we are providing is services to our citizen, and I can tell you that one confidently we are doing. But we are in a political country, so sometimes those, there's the ideal and the reality. So sometimes what the the technical crowd gives sometimes may change. So the issue is to do with TVET. I think, as you say, it was demand-driven. Those things, I think people were looking at, having degrees and those things. But I think where we are in terms of our population, what we require more is hands-on, skills, which are,
Did we need that less then and more now? Or, because if you're talking and saying that it was demand-driven, yes, I understand the concept, but are we saying that the needs we have now were far different from what we had then?
Because the things have changed at the moment. What has changed is that time, at least when you finish a university, you could get a job. But right now, many of the graduates are there and they cannot get a job. So they've realized that degree is not what they need. They need more of a artisan skills.
I guess that is evidence of things happening in the market without the proper guidance from government and implementers of policy. Because it was the market that was forcing the youth to look for the university degree, because the market was now getting to a point where everybody is at the same level, and so you're adding an extra layer for your recruitment. And so you're saying a degree is an added advantage. So people now want to get the degree so that they can get the job. And then you realize, okay, so that one is still not master's added advantage. So you still realize you're not getting the jobs. So now turning back into even these guys that we've hired with masters and all, they're not actually doing the things that we expect them to do. I see a gap here in government, and government not having invested properly into their TVET so they can address the market, or investing in communication between the market and what skills we're putting out there, whether they're actually meeting the skills. Just like you said, a mismatch of skill versus the needs of the country now and into the future.
You see, our brothers here represent a very vital component in our government, meaning population, again, the demographics. For planning, we knew we could see the trajectory of our population. So the planning with this trajectory in mind, at some point we were going to reach a saturation point for requiring all these number of university graduates. And we were still going to need to build houses, we're still going to do plumbing, we still going to need to do carpentry. We didn't need less of it, we're going to need more of it because our population kept increasing. You see, for me, I see a contradiction. There is evidence, yes, but I see it not being utilized.
That's the point.
The point here.
The political side of government.
Yes, I think when you say it's not just about government. It's about stakeholders, right? It's bigger than government, and this is what we call. This is the political economy of decision making. Look at the TVETs we are talking about now. So the experts have said, okay, we need these skills, we need TVETs. And then actually probably very good policy, then it goes out there. And then you have what happens once it gets, so the government puts in money, and people all of a sudden at the constituency level, people realize, this brick and mortar. So very good to have a TVET institution everywhere. But the question is, do we have faculty for all those TVETs? More importantly, have we changed the mindsets of families so that they'll be happy to see their children get the technical certificate in a TVET to become a plumber versus getting the BA at the university. So I think it's not just government, and it's also when you talk about, as I said, I think the evidence is being used in making decisions, maybe not as effectively and efficiently as we would want, and that is part of what we collectively should be doing to make sure that this becomes it's taken more seriously at all levels. And so even the people, even journalists, by the way, you have to take this seriously when you're shaping the discourse.
And that's what we're doing here. Thank you very much for joining us both. Time is up. It's a minute after 10. Bernard Onyango is a senior research and policy analyst at AFIDEP, and Dr. Mohamed Sheikh is the Director General of the National Council for Population and Development. You can get your hands on this new policy and see what it says, so we can all, like Dr. Onyango is saying, we can all participate in decision making at whatever level.
This is the Situation Room, the only way to start your day.